You have to say. So, all right. Going off and sending you the request. Okay. So the request has been sent to Dr. Ram, and now waiting for all of you to come back. Hi, Doc. How are you?
Yeah, can you hear me now?
Yes, very much.
Thank you very much.
Thank you. Thank you. Thank you. For all those of you who are joining us, we solved the problem by simply getting the cover off, so his phone cover came off and now he can talk to us. So maybe a mask for the phone is not such a great idea. Doc, what do you think?
Yes, I'm learning.
You're learning. Yeah. Okay. Diving straight into questions, Doc.
Yes.
First of all, really grateful for you joining us today. I know that you're hard pressed for time, your patients are waiting for you, and this is really a difficult time for you and the whole medical fraternity and for all of the healthcare workers. I wanted to ask you, how are you doing? How's your team coping up with this surge?
First of all, let me say my thanks to you. It's been a nice, break for me. As you said, I've been working long days and it's been very, very taxing. Now, if you ask me how I'm coping, I would say there are two aspects to coping. It's the physical coping, as we have seen that these long days are very, very exhausting. And all I know is I come back, drop onto the bed after a shower and dinner, and I'm out. But what I have difficulty in coping, and the same thing with my team also, is the psychological aspect of COVID. We are in times of crisis. We are facing uncertainty and people are going crazy with fear and anxiety. They are not able to handle the stress of the situation. And I would say a large part of it is because of the media and both the press media and the social media. And the fear component is what is very difficult to handle. It's really impossible to handle. And I get calls every day, from people worried about, these are stable people, but they're worried about what could go wrong. They read in the news that you can have sudden death, you can have sudden breathlessness. And the messages which I get every day, these are the more difficult things to handle than just managing the medical aspect of the patient. And the only way is I think we need to step back and realize that there is no need to panic. This is a situation, we have to face it with a smile and go on boldly with it. The more you panic, the more irrational and unreasonable you tend to become.
Wow, that's sound advice, that the more you panic, the more irrational you're going to get. But yeah, you're right. I mean, almost everyone seems to be saying to us that we should be more worried than what we currently are. We should be more scared than what you currently are. But here we have this word from you that the disease is treatable. Medically, there is everything that you have to treat it. But the fear and anxiety, I think we need to get over that, and we need to get over that quickly. And exactly for that, I feel voices like yours, which are authentic, which are genuine, which are actually dealing with this problem on a day-to-day basis, need to be heard much more. They need to get amplified because, currently we are living in a world of experts. So really, thank you for joining us today, because I do know that it's been tough. I'm going to ask you questions now because, I even sent you a message that we just posted that you're going to come online. We have more than 200 questions within an hour. So, I'm going to try and curate those questions for you. So my second question for you is that we all know that we need to mask, wash our hands, sanitize, keep that social distance. What else can we do? How do you think, like the way you're saying that we're all panicking, what can we do to stay away from this panic? What must we do other than masking and sanitizing?
See, what is very scarce during this time of crisis is common sense. We somehow lose common sense in most situations. We realize that it doesn't make sense, but we still can't, accept. And I think the most wanted entity now is common sense. So apart from, we know that this disease is transmitted through droplets, so we need to mask. We know very well that a person who has symptoms, if he masks, the risk of transmission is much lower than the person who has infection being unmasked and everybody around being masked. But I think what we need to realize is indoors, when there is lack of ventilation and doors are closed, even if you mask, there is a high risk of infection. So the simplest is to ensure that you are outdoors where the ventilation is better, or if you are indoors, there is no problem using an air conditioner, but make sure that the windows are open or there is some form of ventilation so that the air doesn't stagnate. So ventilation is the most important aspect, whether it is parties, whether it is eating, the more you have outdoors, the better you are. Now,
Okay.
apart, you have to remember the simple good food, a 7 to 8 hours sleep. I told you what your grandmother taught you, when you go out and come back home, wash your hands and legs, make sure before you sit to eat, wash your hands, have a good food. There is no specifics in food, vegetarian, non-vegetarian, as you always say, it doesn't matter what you eat as long as you have discretion and common sense in your approach. So that is all is needed. Right?
So you are saying that it's absolutely okay to just eat home cooked food and eat it at home, eat it together. Don't fall for fancy diets and cures and pills and powders and shots and all the
You
random things
hit
that's
on
going
the
on.
head.
All right. Cool, cool. Well, I think today one of the major questions that we are having is that is it possible to have COVID and then get cured, but then all of a sudden drop dead with some major complication that may come your way, like a heart attack and stuff? Or can we just safely say that if you're fairly healthy, then you will recover from COVID and get back to a normal life? I mean, should I worry even after I've recovered from COVID, or can I just fall dead?
You can fall dead at any time. You don't need COVID for that. That is different. But as long as you are healthy in your lifestyle, you eat sensibly, you indulge in any vice in a sensible manner, I think that's all you need. I've seen people who are fit and healthy do far better than people who are obese and who have other issues. With regard to can you fall dead after COVID? Yes, COVID does increase your risk in certain ways. For example, the risk of clotting is increased in COVID. So your chances of getting heart attacks or your chances of getting clot in the blood vessels in your lung is definitely higher than what a person who doesn't have COVID will go through. But having said that, this risk is very, very small. We don't worry about driving on the road. We know that there is a risk of accident, but we take precautions and drive on the road. So similarly, as long as you are sensible, you don't push yourself into exercising after you recover from COVID. You need to give time for the body to recover. You take it easy for a few days or weeks before you go back to your original, whether it is your gym routine or your games routine. That is all is required. There is no worry that you'll fall dead. The risk is very, 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 very low. So I
Okay.
would lose sleep over it. No.
Okay. No, that's good to know. That's good to know from and it's also good to know that we can just fall dead anytime. You don't need COVID for that. I think that's really good. A reality check in times like this, you know. Yes. But this wave, doc, the second wave, as they call it, this time it's also affected children. So, is there any special precaution that we must take with them, especially when when they're isolating? Because isolation for children can be really rough. So, any broad principles for that? When you're at home and recovering, what is it that we should look out for? And especially with children, what should we look out for?
Right. The good news with COVID with regard to children is that it is very well shown that children, if at all they have disease, is much less than adults. In fact, in all the COVID literature, less than 1% of children under 10 have been involved. So
Oh,
the risk of passing the infection to children and the risk of children passing the infection to others is much, much lower than transmission between adults. And severe illness in children is very, very uncommon. It does happen, but it is very rare. And more than the COVID causing a problem, sometimes there is an immunological response post-COVID, which sometimes can cause severe illness in children, which may require steroids or other agents to suppress the immune response. But
okay.
apart from that, I think it has been even shown that closure of schools probably may decrease the chances of pandemic spread by maximum 2 to 3%, not more than that.
Oh,
So, in fact, the risk of keeping the schools open and ensuring shift system, safe distancing, minimizing the number of students in the class, and ensuring ventilation, all will be probably enough to minimize significantly the risk through school openings. So the good news, again, I repeat, You need to worry more about the people who are older rather than children. Children do very well. Usually, they may have a fever for a day and recover very well. I wouldn't worry too much over children. It is mainly the elderly we need to watch for.
Okay, no, that's good to know. And it's also that you're saying that if schools reopen and there is adequate distance and there is ventilation, then it may probably be good for children. Is that right?
Absolutely. In fact, I see more the damage caused by lack of schools. Children have been off school for over a year. Whatever online or virtual classrooms you have, the psychological trauma of children who are, in nature, generally outdoors, playing with kids their age, is being phenomenally, affected. So
Of course.
I have seen children going through a lot of psychological trauma, disturbances, panic attacks, depressions during this time. And I think we need to get back to school sooner with all precautions in place.
Well, Doc, you need to just say that much more loudly and much more enough to, tell everyone hears it, because I think this whole home online school has been a major, major stress factor for everyone involved. And for me, I get emails from like parents of 4-year-olds who are saying, okay, I'm seeing graying of their hair. They're seeing changes in appetite. So you're absolutely right that the psychological damage is really big. But what about vaccines? There's like a whole lot of confusion about vaccine. We have gone from vaccine hesitancy to give me the vaccine now. Which one should I take? How long should I wait? What's your word on vaccine? How should we go about it?
See, it is very clear that if we need to beat the pandemic, you need to get the immune level of the community to at least 70 to 80%. Now, if you're going to let a natural infection reach this stage, you need to go through at least 3 to 5 waves. We are probably in the second, maybe in the third wave. We need at least another 2 to 3 waves before we can get to immunity, which will be better.
Wow.
That is not going to be a sensible approach. Vaccines are the only next resort which we need to take up. So the basic advice would be just take your vaccine. We have so much of indecision and hesitancy regarding vaccines. I think the benefits of vaccines far, 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 far outweigh the risk. We need to understand the vaccine is not just to protect us. It is to protect our families, our near and dear ones, the elderly people. It is for protection of the entire society. So the sooner you take the vaccine, better. With regard to what vaccine, it doesn't matter. Whatever vaccine is available, you take it, except it has shown that Covishield probably has a higher risk of clotting and complications in young women. So if you are a woman, probably under 30, avoid Covaxin, go for another, vaccine. But avoid Covishield and go for another brand. But apart from that, there is not much to differentiate. The fact that this is 95, this is 94, this is 81, this is 72% efficacious is actually irrelevant, because the method used to derive that number is in trials, and it is not something which you can apply to the real world.
Okay.
All vaccines are safe. All vaccines minimize the risk of death, hospitalization, and serious illness. So just take the vaccine.
Just take a vaccine. And if you're a woman in her 30s and stuff, maybe not Covishield and another vaccine. Is that correct?
That's right. That's perfectly.
Is this because of women wanting to get pregnant around that age, or anything to do with fertility and stuff? Because those are also the questions that people have for you.
No, the thing is, the Covishield, unfortunately, has been associated with a higher risk of developing clots, along with a low platelet count, usually 5 to 20 days after the first dose of vaccine. If you've had the first dose of vaccine and you're fine, you can go ahead with the second dose. But if you've not, and you're a young woman, choose an alternative to Covishield. That's the only advice.
Okay, all right. That's nice. If you're a young woman, look for an alternative to Covishield. But what about women who are trying to, because that's one of the questions that we had. If someone's trying to get pregnant, or if someone is already pregnant or lactating, can they still go ahead and get a vaccine, or should they wait?
It has again been clearly shown that pregnant women have a higher risk of complications than non-pregnant women. So pregnant women definitely need the vaccine. The currently available, none of the vaccines are licensed for pregnancy. So legally, you're not entitled to give them. But my recommendation is this should be a decision, an informed decision, which is taken between the doctor, the patient, the woman and the family, where they discuss the benefits and the risks. With regard to the benefits, it's absolutely beneficial, decreases the risk of complications. With regard to risks, so far evidence available says that there is no increased risk in vaccines in pregnant women or breastfeeding women. So as long as you understand that risk is negligible or it is not there, even though the vaccine is not licensed, if all three agree, I would go ahead and vaccinate the woman.
All right. So you're saying that if you're pregnant and lactating, speak to your doctor, take an informed decision, and
Yes.
you would vote for the vaccine and not really against it in most cases.
Exactly. Yes.
Okay. Good.
The benefits outweigh the risks.
It outweighs the risk. The benefits are outweighing the risk. Good. That's good to know. What about the second dose? Is that absolutely necessary, or you can take one dose and then forget about the second one?
No. It has been shown that most vaccines, depending on the duration of the interval between the vaccines, the first dose, the immunity starts waning, coming down. So you need a second dose to boost up the response. So except for the J&J vaccine, for which only one dose is recommended, for all other vaccines, the recommended dose interval has to be observed. For Covishield, the longer the interval, up to 12 weeks, the better. So you can wait up to 12 weeks to take the second shot of Covishield. The rest as per recommendations.
Okay, so you can wait up to 12 weeks till you get, can I ask, till you get the second dose. Can I ask you one more vaccine related question, please? If someone gets, COVID positive, so number one, after my first dose, will I get COVID positive? Does that happen? Or nothing happens to me after my first dose? And if I do get COVID positive at some point, in these 12 weeks before my second dose, when can I go and get that second dose?
Right. One thing I want to make very clear, the vaccine does not give you COVID. Whichever
doesn't
vaccine.
Give me COVID? Okay, that's
absolutely
good to know.
Not. The vaccine only stimulates the immunity. It doesn't inject the virus or induce the occurrence of COVID in any way possible, as far as evidence currently available shows. So please don't worry that if you take the vaccine, you'll get COVID. But yes, we have seen a lot of patients who develop COVID within a few weeks after getting vaccination. Now, one of the reasons this could be is what is attributed as the Peltzman effect. Sam Peltzman was an economist in Chicago, and he subscribed to this concept of the Peltzman effect, where he said that the perception of safety increases the risk. In other words, if you have a security measure mandated, then people tend to take an increased risk. He actually started this with regard to safety belts. Safety belts used in cars are used to minimize the risk of death in case of accident. So it was believed that if safety belts were worn in cars, the number of deaths due to car accidents would come down. But paradoxically, the safety belts in car made no difference to the deaths. This was because people who were belted took extra risks because they thought they were safe, and more people who are pedestrians also died in accidents, which means a perception that you are protected increases your risk, and thereby the risk taking, and thereby the occurrence of the whatever event which is not desired. So if you take a vaccine, you'll think you're protected. You may be less compliant with the masking or social distancing, and that may increase the risk of COVID. Not the vaccine doesn't cause it.
Not the vaccine, but the fact that you may take it easy and go, oh, I'm vaccinated, gale lag jao,
Yes.
All right. So you're saying with the vaccine or without the vaccine, one must still wear the mask and social distance and sanitize?
Yes. Because the vaccines do not prevent infection. They only minimize hospitalization, severity of infection, and definitely prevents death. But infections can still happen.
Okay, but that's like a sure shot that it will surely prevent hospitalization, landing up in an ICU, dying because of COVID, but you may still get the infection, but it should be a milder version.
Yes, the only caveat to this is we are now getting a lot of variant viruses, mutated viruses which are coming up. So the vaccine may not be as effective in preventing these infection due to mutated virus, but hopefully the vaccines will be tweaked so that they will also be covered soon, I hope.
Okay, that's good to know. That's good. All right, I'm going to ask you, do you think our government has been responding appropriately to this pandemic, or do you feel that for all the hard work that you and your team has been doing, for everyone in the medical fraternity has been doing, that you maybe deserved better response from the government? So anything that you would like to say about that? Can we do things differently as a nation?
Right. No, I think the government has done a reasonable job so far. This is a huge nation, which is very difficult. It is not like Singapore or, Belgium or UK, where the population in this is phenomenal. So I think it has done a pretty good job. The only, shall I say, comments or suggestions I may have is with regard to the vaccination drive. I think probably the government should have been a little more communicative, little more transparent in the collection of data of adverse events following vaccination, little more expressive as to the safety of the vaccine. We need more champions. I just wish the politicians had led from the beginning saying that the vaccine is safe, so that when they get vaccinated, it's normal that more people will get vaccinated. So I think that's probably it could be handled a little better, but otherwise I think India has done a reasonably good job.
Oh, that's good to know. That's really good to know. So you're basically saying that we've done a good job, but we could have done a better job with communication.
Yes.
Of the benefits of
this panic. I told you this panic about the death and dying, all that. I think they should be a little more communicative in the actual statistics, because the news, the press, and the television are taking us, out real bad.
Absolutely. No, that is true. That is true. I have almost everyone that I'm talking to, especially my clients from abroad, asking me, how are things? Are things as bad as, as we see them? Or, and a lot of times it's like, I don't know what's the right answer. What's the right way to say that we are actually doing okay. Of course, in a few places things are bad, but then I think we do have doctors who are dealing with it. And I guess, like you rightly said, that medically you're able to deal with it, but the whole panic around it, that's the tough one to tackle.
Killing.
Yeah. Yes. I also want to ask you that as patients, we have many things that we look for in our doctor, and what makes for an ideal doctor and stuff. Do you have things like what makes for an ideal patient? If I'm COVID positive and if I come to you, what are the qualities that you look for? What kind of patients, or do you have a patient type that responds to treatment better as compared to another type? What can we learn, to be good patients? What do we need to learn?
On lighter vein, the only thing I will request my patient or expect my patient to be is somebody who doesn't Google and come and ask me questions from Google. That's the only thing I would like. Because now in the times of WhatsApp and Google, everybody has finished university with a PhD. So,
Yes.
they come and tell you what we should do for them. We have studied medicine for 15 years and practiced. I wouldn't say, working. We are still practicing for another 30 years. But they read Google in a matter of a few hours and then come tell you what is to be done. So that is what I think we should avoid. But anyway, lighter things apart, if you ask me for an ideal patient, I would expect, I tell all my patients, we will take care of the medical aspect, don't worry. But there are two aspects which we cannot do, which I want you to do. One, I want you to eat a good diet. You're a dietitian, and this is something which is very basic. So I know during times of COVID, your appetite is poor. But whatever it is, ensure that your nutrition is adequate so that your immune system responds. It has been very clearly shown that stress is an anti-immune, has an anti-immune activity. The more the stress, the greater the chance of severe infection. So you need to reduce the stress. So second thing I tell them is you need to have a positive mental attitude. The more you are positive and are able to fight the disease, the sooner you'll get better. So an ideal patient is someone who takes his food, however bad it is, and two, stays positive during these times so that he'll go home sooner.
That's good. That's really good to know, because sometimes when I say to people that all that you need to do is like really just eat your home cooked food, eat your regular dal chawal, roti sabzi, sleep on time, blah, blah, blah. They're like, isme kuch scientific nahi hai. Tell us like one thing that we should, like, there are specific things that we need to do, or, but like you said, that common sense trumps everything else, right? I mean, COVID or no COVID, ghar pe khao, shanti se khao. Okay, all right, good. If I'm the type who just receives a whole lot of WhatsApp gyan all the time, because there are endless endless forwards about. I saw a recent one which had like everything about spices and the amount of oxygen in spices, so the amount that we would need to eat, and anything else about, you know, the WhatsApp gyan on everything that is that's COVID and cure for COVID. How do I save myself from being influenced by what I'm reading online about cures? Because these often come with endorsements also. कि मुझे you know, I was positive and then I did this and then I'm negative. So what would you like to say to that?
What you said is perfectly true in the sense that the infodemic or the information pandemic is killing. You know, people mean well, but the kind of false information that goes through these WhatsApps and other media is very, very influencing and can actually do harm. So the simple one is delete your WhatsApp. But since you can't do that, you have other things to do. In that situation, I think probably the first thing is always try to ensure that the validity of the information is correct. In the sense, is it authentic? Because anybody can put anything on the WhatsApp or Google and no questions asked. Yes. So try to check the authenticity and please talk to your doctor. That always helps. The problem is the doctor also reads that WhatsApp and gets influenced. That is different. But you have to, nothing, as you said, nothing trumps common sense. So try to not to forward these information till you check that and make that they are true. And keep your social time less, especially with regard to watching news and watching social media with regard to COVID. If you decrease itself, your stress is halfway down.
Yeah. Oh, good. That's good advice. Delete WhatsApp. I think I'm going to consider that seriously. While we are on that, you know, people are saying that the virus is now airborne. So is that true? And should, you know, you also said earlier that we should be more outdoors, there should be more ventilation. But now that we are hearing news about the virus being airborne, people are actually worried about keeping their windows open or going outdoors.
Yeah, it is definitely shown that the virus can spread because it's not just the large droplets to which the virus attaches itself. So it doesn't fall and drop within 3 feet. Sometimes it attaches to very small particles that can float in the air for several hours. So in that situation, if you are indoors without great ventilation, the circulating air carrying the virus can enter and cause a problem. So that is why two things: as much outdoors as possible. If you're indoors, increase the ventilation, improve the ventilation as much as possible. If other people other than your home, you know, your immediate families in the house, avoid that. That will minimize the chances of airborne transmission.
Okay, that's good to know. So ventilation is something that one must do. What about the mask at home? What about this thing of like wear your mask at home? What do you have to say about that?
No, that is not common sense. You cannot wear a mask. I wear a mask almost 10 hours every day from going to coming back. So it's not feasible. As I said, you know, you are going to be with your family. As long as everybody in the family takes the same precautions with discipline, I don't think you need to worry about wearing masking in the house. Wear a mask, no.
So washing hands and being disciplined, that's a good enough mask while you're at home.
Absolutely.
Okay, good. What about plasma? You know, one hears about plasma donations and stuff. What do you have to say about that? Is there any truth in it, or?
I think there have been a lot of studies done with several agents, including hydroxychloroquine, azithromycin, doxycycline, ivermectin, plasma, ritonavir, lopinavir. None of them have stood the test of scrutiny. So there is no rationale, including taking zinc, including taking vitamin C, vitamin D. None of them have been proven to specifically benefit COVID. They may have some.
You are upsetting many experts, I must tell you.
Yes, I'm being very provocative here. It is believed that these act and improve your immunity. Yes. But with regard to COVID, I don't think any of these have shown to improve outcomes.
Yeah, of course. Yes. No, but that's really good to know because, you know, I think the chemist ran out of vitamins and zinc and vitamin C and stuff. I think for the very first time in their lives, they ran out of vitamins. Yeah. But you're saying it's going to take much more than just popping pills to build immunity.
Good sleep, think positive, have a good, as you said, home cooked food. That's all you require.
That's good. That is really good to know. That's really good to know. There's also questions about there are people who are on immunosuppressants for, and they're supposed to be on these immunosuppressants for a very, very long time. Is it safe for people on immunosuppressants to go ahead and take the vaccine?
The vaccines, whichever vaccine is currently licensed, is very safe for use, whether it is Moderna, Pfizer, Covaxin, Covishield, Sputnik. It doesn't cause any harm to the person who takes in general, whether the immunity is good or not. But in people who may be taking immune suppressant drugs, the response or the immune response for antibody production may not be as robust as somebody who's healthy. So their protective effectiveness in the vaccine may be blunted, but the vaccines are perfectly safe.
Okay, that's really good to know. So they can go ahead and take the vaccine. It just may be a blunted response as compared to what it would have been if they were not on the immunosuppressants, but it's safe.
Yes. Yes.
Okay. No, that's good. I'm going to now ask you some questions from the live, just a couple of them. You do have about 5 more minutes with us, right, Doc? You can spend.
No problems.
Thank you. What about the medicines, the regular medicines that that one sees requests for on social media and stuff? Are we really running out of them, or do we have enough for the people who actually need them?
See, the only medicines which seem to help in COVID or only interventions is one, oxygen in people who are oxygen level falls below 94%. Two, steroids, again, in people whose oxygen level falls below 94%. I reiterate, steroids are not for everybody. It is only for people whose oxygen drops below 94 in room air. Now I find everybody popping in steroids. We see so many complications of steroids. We see fungal infections which start through the sinus, invade the eye and the brain. We have had several young people die because of these fungal infections. So please don't pop in steroids the minute you get diagnosed to have COVID. It is only for hypoxic or people with a low oxygen level. Apart from these two, which make a dramatic difference, the oxygen and the steroids, none of the other medicines make a huge difference. There are only two other medicines which I would like to comment upon. One is remdesivir, which is an antiviral agent, which again, if given to people with a low oxygen level, preferably within 7 to 10 days, I repeat, preferably earlier during the course of the illness, it decreases the duration of illness. It doesn't do anything more than that. There is no mortality benefit. It only decreases the symptoms. And lastly, a drug called tocilizumab, which is a very expensive drug. It costs anywhere from 40 to 80,000 for a course of 1 or 2 injections. This probably decreases the chance of progression in a person who's rapidly deteriorating. So both remdesivir and tocilizumab is to be used in admitted patients with low oxygen or who showing deterioration. Apart from these, none of the other medicines have shown real evidence in improving outcomes.
That's really good to know. No, that's good to know. And we should wait for the doctor to ask us to get these medications, right? I mean, we don't need to. If I get a positive report today, should I go around looking for these meds?
No, that's why stop Googling, stop taking the decision. Doctors have studied, worked hard to get where they are. Don't think that you can, learn things in a matter of a few days reading WhatsApp and Google. Please be patient, use your common sense and speak to the experts before you decide on the medicine.
Right. What about CT scan? At what stage should I get a CT scan? Should I bother with an RT PCR test? It's, so is a CT scan required, and when is it required, if it's required?
I'm happy you raised the question because nowadays I find everybody coming to see me with the positive PCR test, CT scan, and a whole lot of tests, half of which make no sense either to them or to me. So please don't get paranoid in doing this. A CT scan, I feel, is limited or is beneficial only in somebody who's deteriorating. You need to assess lung involvement in the lung. Because what happens is they do the CT on the day 1, the CT is normal. Then after 5 days, the patient starts slowly deteriorating. They do another CT scan and another CT scan. And please remember, CT scans give irradiation. They are not safe to be repeated again and again. They have their own damages. So I don't ask for CT scan for anybody. If at all a chest X-ray to document things are fine. If they deteriorate, if they get hospitalized, or if they behave in a manner where there is sudden deterioration where I may suspect a blood clot in the lung, only then a CT is indicated. Similarly, there are several blood tests, including your white cell count, which may go low, your platelets, which may go low. The C-reactive protein, it may go up. But there are other tests like the D-dimer, the interleukin-6, the ferritin, the LDH. All of them have slight importance in prognosis, or if they are raised, you can say maybe the person has a severe inflammation, but more than that, it doesn't give you a hell of a lot of information. So doing them repeatedly will confuse you rather than help you.
Okay, so you're saying no need to get a CT scan. If it's required, no. Your doctor will ask you for one. Maybe you need it in a hospital, but not like on your own. Chalo jaake CT scan karte.
Correct.
Okay.
It is not like vada pav or something where you just go and get you feel like. No.
Yeah, no. What about an RT PCR? You know, like I read so many questions about that. RT PCR karna chahiye kya? If it is 70% real, then what about the 30% and stuff? It's all quite confusing. So tell us about that.
See, the RT PCR, I tell anybody who calls me with, say, I have fever or body pain or, loose stools, and I suspect possibility of COVID, but they are very non-specific. The only thing I tell them is first isolate yourself. Now, this disease is infectious to others even 2 days before somebody presents with symptoms. So if I have a fever today, I may have been infecting my family yesterday and day before. So already the done. So the minute you realize there may be something wrong, isolate yourself. Wait for a day, see if your symptoms are persisting and your symptoms are worsening or whatever, and then get an RT-PCR done. So isolation is more important than running to diagnose. I have seen so many people with a low-grade fever, do test after test after test for 4 or 5 days and then get detected to have COVID. So isolate yourself, wait for a day, get an RT-PCR. Diagnosis of a COVID is not a death sentence because the minute they get a positive test, there is panic. People come rushing in with a CT scan, with a blood test and asking for admission. Only more than 80% of people don't even need to see a doctor. They get better without any issues. 20% require a doctor's input and maybe hospitalization. And only 3 to 5% become serious. So please remember this. Not everybody needs to panic. And if you require hospitalization, then the doctor may ask for further testing. So you don't go around doing all the tests before as soon as you're done.
So first of all, you're saying only 3 to 5% may require hospitalization, and in that case,
about 20% may require hospitalization and medical care. 3 to 5% may become seriously ill, requiring higher oxygen levels.
Okay, all right, I got that. 20% may require hospitalization. 3 to 5% may get really severe, but there's a larger percentage who can just get away with just isolation, staying at home, following the basic commonsensical stuff.
Yes, okay. Lots of common sense.
Yeah, lots of common sense, running really low right now, But there's another question about if I'm isolating at home and I've completed, let's say, 14 days of isolation, at what point is it okay for me to go out and mingle with the rest of my family?
Right. The studies have shown from the Center of Disease Control in the US that in people with a mild disease, people who don't require hospitalization, who have a fever, nothing else, and their fever settles within 7 to 8 days. In 10 days' time, you can come out of isolation.
In 10 days' time out of isolation, that's good.
So people who become free of fever and feel much better by 10th day, the virus cannot be cultured from the respiratory tract beyond 8 days in most people.
Okay.
But the PCR test, which may detect the dead virus, may be positive for several weeks. That's why we say never repeat a PCR once you're positive. A positive test, if it's mild, after 10 days, you remove the isolation. For people who may have a little prolonged fever, you isolate for 14 days. Okay. Beyond that, in community, in home isolation, you don't need to do anything. People who are seriously ill in hospital or a ventilator may require isolation for up to 20 days because in such patients, there may be a high viral load where isolation may need to be prolonged. But even in them, beyond 20 days, you don't need to repeat the test. You can remove isolation without any worries.
Nice. This is really good to know. So after 10 days, if you have no symptoms, don't need to repeat the test. You can go back to living a normal, commonsensical life with all precautions in place.
Yes.
Severe cases, you're saying, again, not required beyond 20 days.
No.
Of isolation. That's really good to know. Now,
and no repeating test. Don't repeat the test. Everybody wants to know.
That's important.
Yes, PCR, repeat, PCR. Don't repeat because you start going through that road, you'll end up getting repeat PCRs because I have seen people who have been PCR positive for up to 8 to 9 weeks.
Oh, wow. My God. Okay. So
Don't.
no need to repeat the test.
No.
If there is no symptom, you're okay after isolation and stuff.
Yes.
Okay, that's good. Uh, One last, okay, maybe two last questions. What are your views on steaming?
You really want to know my views on
Yeah,
steaming?
I really want to know because
I don't think steaming, there is no evidence, medical balanced evidence to say that steaming helps. But having said that, if people feel that they benefit from steaming, let them have it. I don't say don't steam, but if they ask me, should I steam? I say you don't need to steam. Steam doesn't make any difference. It just makes you feel good. And if it does, go ahead and do it. But otherwise, I have a lot of people who say every time I steam, I start coughing. I say, don't steam.
yes, yeah, yeah,
So,
yeah, yeah. No, that's good to know because I think people are again like steaming like it's going out of fashion, you know. All right. And one last thing, if people are getting muscular cramps and headaches and body aches, even after, but they're not having fever anymore, what's your advice for them? What should they do? Should they take it easy? क्या करना चाहिए?
now, these people are called as long haulers. Most people will settle
Okay.
in 2 weeks' time, but there is a significant percentage, anywhere from 30 to 40%, who continue to have symptoms even beyond 2 weeks, sometimes 3 months, sometimes 6 months. They are called long haulers. These symptoms may be anything as trivial as a dry mouth, uh, appetite disturbances. It could be body pains, joint pains, cough, loss of hair, breathlessness on walking, tiredness, confusion, inability to concentrate, panic attacks. All of this can go on for several months in some people. We see less of them in India than in the West, but yes, we do see symptoms, quite distressing symptoms in several people. So these symptoms have to be individually evaluated and treated symptomatically in most people. But in general, over 70-80% do very well. And I feel in India it is much, much higher. Almost 90% settle down in 2 to 3 weeks' time.
Okay, okay. But otherwise, you're just one of those long haulers. Take it easy and know that you're going to be okay soon.
Absolutely. Because the more you get obsessed and panic about it, the more difficult it is to face it.
Yes. Okay. No, that's good. That's good to know. Doc, there are way too many questions. Can I ask you a couple more?
Go ahead. I'm free tonight.
Thank you. Thanks. Thanks. It's one about maids. Is it okay to let them come home?
See, again, common sense. You have been used to a system of life, and suddenly they say no maids, no, cooks. No, it's going to be very difficult for more people. Let us be practical. There are people who have to work on their own, but unfortunately, a significant number of people who are working get used to a system whereby they need support. We don't live with our parents, grandparents as a joint family where everybody pulls in. Now it is all individual families. We need help. So I believe, yes, again, common sense. How do you do it? You ensure that the maid is masked or a cook is masked when they come to your house. Preferably stay out of the way. If they are in the kitchen, you stay
Right.
in the hall. If she's cooking, sweeping your bedroom, you stay in the dining area, whatever. So you physically separate yourself from them, make sure they are masked, and educate them. Tell them that if they have symptoms of fever or cough or body pain or loose stools, to take a couple of days off. I know they may take advantage of this, but it is still better to be safe than sorry. But I believe that you carry on with life with modifications, with common sense to ensure that you stay as protected as possible.
No, that's good. That's good to know. Um, if a woman is menstruating, can she go and get her vaccine on that day? Because again,
Yes.
there is like a lot, I think, around that.
No, you have to remove science from myths and religion and culture. Science is science. So as far as science is concerned, there is no issue. You can take it.
Okay. All right. I think we will let you go because the questions are endless. But I think there's a lot that you have shared with us already. If you had to tell us three important things that we must remember while isolating ourselves at home, what would they be?
When you say isolation at home, it means physical distancing. So you can stay inside. If you, assuming that we have a room to stay in, even without an attached bathroom or an attached toilet, it is perfectly fine. Stay away from all the others, physically distanced. If anybody is going to come into the room for whatever reason, make sure you are masked and the other person is also masked. There is no worry about food and other things which is being sent in or whatever, contaminating the household and the others. You can be normal as long as you wash your hands, wash your plates as you normally do. You don't need to sanitize the room entirely when you leave the room. The virus dies as long as you leave the windows open, ventilate the room for a few hours. I wouldn't go around scrubbing everything with alcohol. Sweep and mop and leave it as it is. Simple reasons is all that you need to keep yourself safe.
That's good. That's really good. And last words of advice from you. What should we all remember during this pandemic? And how can we use our own common sense? If there was any way to do that, like what can we do? Your last words for everyone who's watching you. The more than 4,000 people have seen you from across the globe, Doc. And other than finding your session extremely informative, I think people are really relieved because now they don't see COVID as a death sentence like it's been made out to be. Besides that, there are many, many compliments for your looks and your smile. So I feel sorry for all the people who are unable to see that smile when you're masked up. I think we've all been really lucky to be able to watch you smile like the way you're smiling. So last words of advice for all of us. हमको क्या करना चाहिए?
Okay, I'm going to leave you with words of what is known as commonly as Stockdale paradox. Now, this is a situation where if you're going through a very difficult time, you need two things. One, an absolutely optimistic bent of mind to accept that things will change for the better. And two, accept the reality as it is. This is called the Stockdale paradox. So you need to accept that things are bad. Things are, quite difficult, quite traumatic. At the same time, have an unwavering optimism to tell us that this will get better. So that is the only trait which has been shown in any time of crisis to pull you through and make you feel better. So if you do that, keep yourself calm and keep telling yourself that this too shall pass. At the same time, you have to accept, you have to wear a mask, you have to accept physically distance, you have to accept the realities of what is going around. I think you will survive this without any problem. This too shall pass.
That's great to know. That's great to know. For I would like to thank you, Doc, very much, and for everyone at your team and at your home for allowing you and getting you that free time to actually be able to spend time with us. This session has been extremely helpful. It has helped me personally in various ways. Everything now seems to be like all is well, all is well. ठीक सब कुछ हो जाएगा. And really, thank you for that vote of confidence in doing the really basic, commonsensical things when it comes to even infectious diseases like COVID-19. For all those of you who are watching us, you can even follow Doc from his handle. It's @capstone says, and he's been posting some really informative videos about vaccines and about common sense and about all of the wonderful things that he has to say. Doc, really good information from your handle. So I do hope that you will keep posting more often. And for all, because there have been many questions which we haven't been able to take, but I think if they get in touch with you on your handle, that should be good, right?
Absolutely. It'll be a pleasure. I really enjoyed this evening with you, Rujita. As I said,
Thank you very much. Thank you very much, Doc. Thank you. Thank you.
Thank you.
Thanks. Bye. Thank you everyone for joining us. Thanks.